I think, we certainly need more information of what the governor knew. The governor is the one that indeed did sign that executive order, which many of us disagree with and has led to thousands of deaths. And so certainly I think that the governor needs to take accountability. He needs to answer the questions that the public has. And we need to make sure that we are holding this governor accountable. So I think for me and most New Yorkers, there are two main questions that people have. One is, what information did the governor base his decision to mandate nursing homes to accept COVID positive patients, even after they said they did not have the ability to care for them? And why did that executive order even continue after we had alternatives like the U.S. Navy Comfort Ship, which President Trump sent to New York Harbor? The Javits Center was set up as an emergency hospital. Also locally, Staten Island, the South Beach Psychiatric Center was set up as an emergency hospital, and they were not operating at capacity. So they could have certainly taken those additional COVID positive patients.
Yeah, you've been very vocal about your suspicions of the number of COVID-19 deaths in nursing homes all along. You were one of the first to push for the investigation. And what made you call for that investigation in the beginning?
Like so many of my constituents, I was very outraged by the number of deaths that we saw coming out of New York nursing homes, much larger percentage than you saw in other parts of the country. I was also very much upset with the governor instituting that executive order that mandated these nursing homes take COVID positive patients. In many cases, the local nursing homes that I spoke to on the ground, they felt that they were not equipped to take those patients. They told the health department that, and yet they were forced to continue to take those patients. Secondly, there was a lack of testing that was available to identify and then isolate those nursing home patients or staff members to make sure that they didn't infect others in the nursing home community. So these are a number of things I think that should have been done differently.
And so the numbers were off by about 4,000 with this report coming out. The new data released from the Department of Health puts the total number of COVID-19 related deaths of nursing home residents at 12,743. That's compared to 8,700 originally reported. The health commissioner, as you were just talking about, he dismissed the report of undercounting, saying the Department of Health made clear that the numbers are reported based on the place of death. Your reaction to that?
Yeah, well, it does matter that these individuals were infected at the nursing homes, because that is the whole argument we've been making this entire time, that COVID positive patients should not have been put in the nursing homes with the most vulnerable. We knew from the beginning, and the one thing we knew from the beginning was that the most vulnerable were our elderly, those with underlying conditions. They were the ones that would most likely die if they were infected with the coronavirus. And so knowing that, it was a very misguided decision by the Cuomo administration to place COVID positive patients in those nursing homes. It's like putting a fox in a hen house. You just don't do it. And now the fact that he's trying to justify this by saying it doesn't matter whether they passed away at a nursing home or a hospital, it certainly does matter. What matters is, where were they infected? And if they were at the nursing home and then transported to the hospital where they passed away, then that means that it is due to the executive order that the governor put in place on March 25th.
And the governor is actually blaming the Trump administration. What do you make of that?
Well, I mean, that's been their tactic all along. When anything goes wrong, to blame the Trump administration and try to deflect from their responsibilities. The reality is that on March 17th, Governor Cuomo said, "The buck stops on my desk." And so that means he needs to take accountability. He needs to take ownership of what occurred here. And I don't see him doing that right now.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.